Right. Good afternoon, everyone. Thank you so much for joining our March 2023 very first charity webinar. To let you know, we are recording today, so if you do not wish to be on social media or on our website, please turn your camera off. We will run through a quick agenda for you. So today I have a few speakers with us today. So I have Tanif Ellis, who is the General Manager for Children's Services. I have Sabina Hazel, who is a parent and a member of staff who has a very, very personal use of the NICU many years ago. We're going to be talking about current donations, so being a patient's parent, what it's like to be a parent on the unit. Then we're going to update on the moves on the unit, and then I'm going to be talking to you about fundraising plans, and then we'll have a question section at the end. So if you wouldn't mind holding your questions until the end, I will be very grateful. So hopefully you have all grabbed a cup of tea and are ready to hear what's coming up. So because of you, we raised over £800,000 for our neonatal department at Luton and Dunstable.
Where's the money gone then?
That is absolutely phenomenal amount. Thank you so much for raising all this money. We couldn't thank you anymore. It was incredible. So what you probably want to know now is what we are now doing to spend the money. So that's why I'm going to pass on to lovely Tanif, and she's going to explain to you all how we are spending that money. So thank you very much, Tanif.
Thank you. And yeah, I think the first thing to say is that money is safe, and most of it is actually still there. As any of you know that have been involved in the neonatal charity for at least the last 10 years, but certainly I've been in tenure looking after the neonatal unit, and a few years before that, the charity was set up when we originally started to look to develop a new neonatal unit. And yes, the truth is we are 10 years on, but that money has been kept safe and invested. We have used it for a few things. So we've probably spent in the region, just looking on the slide, the top 2 items we've bought over the last 8 years. The retinal camera, and that's a very specialist piece of ophthalmology equipment, and it allows us to take photographs of very premature babies' eyes, so we can look right through to the back of the eye and identify any retinopathy, so any eye issues that are prone to premature babies. It is rare, but it can be there, and the camera allows us to take images and look at those, and allows us to treat early and preserve the eyesight of neonates that we identify with any retinal issues. And any of you that might watch this that know that your baby's had laser treatment in those early weeks of their life, it's this camera that's allowed us to do that and allowed us to identify it. And those cameras range at around £100,000. So it's a piece of, very technical equipment and expensive. So we've used the donations towards that. And the other piece of equipment that we purchased about 5 years ago was a brand new up-to-date ultrasound machine. So that allows us to do cranial ultrasound. So looking at babies' brains, very premature babies or babies that have been born through a difficult birth may have some bleeds on the brain or issues, and the ultrasound allows us to look at that so we can monitor. It allows us to check their hearts and how their hearts are functioning. And more recently, we've had doctors trained now to start to look at babies' lungs as well. And we know that because of being premature and having to be ventilated and supported with their breathing, that lungs do become damaged and really do struggle as a result of being very premature. And the ultrasound allows us to really keep some monitoring on that, look at early treatment, look at the impact that it's having. And again, those pieces of equipment sit at around £80,000. So those are the two items that we purchased out of that original 800, and the remainder of that money is still there. And we'll come on with the charity team about how we're going to use it. I'm going to hand over to Claire just to talk to you a little bit about our STAR transport system, because that's a brand new piece of equipment that we're going to be bringing into the neonatal unit over the next 12 months, just prior to moving, so that we've practiced using it and it's there and available to us as soon as we move across to the brand new unit. So if I can hand over to Claire. Claire's our lead nurse for neonatals, and she's our operational manager. So Claire, can I just hand over to you to talk a bit about the STAR transport system? Not sure if Claire's having problems with. Charmaine, is it me that can't hear Claire? No, maybe just having difficulty with the sound. So I'll do my non-clinicals. I'm a non-clinical manager. I do know my department well. Basically, this is a brand new piece of equipment that allows us to move babies much more effectively from maternity department through into the neonatal unit. What we know about babies is they don't, when they're very premature or they're unwell at birth, they don't really like to be handled too much. We have to do an awful lot with them to support them with their breathing and make sure their hearts and such like are working. But what they don't want to do is be moved from one piece of equipment to another too many times in those first precious hours. So the transport system allows us to basically connect the ventilator and the equipment that we're potentially resuscitating them on and looking after them on. We then connect it to the transport system when we move them on that piece of equipment. Whereas at the moment, we have to move them from a resuscitator into an incubator and then into the neonatal unit and onto another piece of equipment, which is 3 or 4 times of handling a baby. This brand new piece of transport system just allows us to connect everything up, connect the oxygen, the air, the heating systems, all of that precious equipment in one piece, and then move the baby. And this is going to be, it's going to be valuable now, although we're right next door to maternity, but going into the new acute services block and in between maternity and neonates, we've got a floor above. So we're 2 floors above. So there's a journey from maternity up into the neonatal unit. And this is going to allow us to do that in a much more effective and safe way for babies. The distance isn't an issue in case anyone's concerned about that. Most and many maternity and neonatal units across the country have a bit of a distance, are often a lift journey away. But this system is brand new and will allow us to do that safely. And those, again, you know, the whole system range between, I think it's 50 and 100,000 pounds. And our intention is to buy 3 of those so that we can be moving more than one baby. So if there's twins born or triplets that need it, but more importantly, it allows us some resilience in our equipment. So I hand back to Charmaine. Thank you.
Thank you, Tanny. That is, I don't know about anyone else, but I didn't know a lot of that information, and it is so informative to hear how technology has moved on. A retinal camera that can take a photo of a neonatal's eye is impressive. I mean, your eyes aren't very big anyway, but to do a neonatal's is impressive. So, you know, it's absolutely fantastic to hear where the equipment is being used and how it's being used and how much of a difference it's going to make to the team, but also to patients as well. So that's wonderful. And thank you very much for updating us on that. So up next is Sabina. She'll tell you her story.
Yeah, so hi everybody, my name is Sabina Hazel. And for those of you that don't know, my son Mason, he was born 3 months early, some pictures you can see here, and cared for by the amazing neonatal intensive care unit, who, yeah, basically, as you can see, saved his life. So that's kind of where my passion is, and that's why I do the job that I do, and I'm very lucky to do it. I started off by fundraising for the unit, myself and a good friend of mine. We started organising some fundraising activities and started fundraising. So altogether, I think in the end, it's about £12,000 that we raised for the unit, doing various activities and events. And I started working for the charity team as a charity ambassador. And then the role that I do now, so schools coordinator, so working with local schools, colleges, nurseries, to fundraise for the hospital. But yeah, my passion is clearly NICU, and that's where my heart really lies. So yeah, it's great to be able to do the job that I do and give something back. But also hearing about all the equipment and machinery that is going to be purchased or has been purchased with the money that's fundraised, it really does make a huge difference. So, you know, from being a parent and going through the journey personally, you know, hearing examples for, you know, taking the baby out of the incubator, they don't like to be held and managed too much. And I remember at the time when I could cuddle Mason, I was really surprised, and I was like, oh, I don't know if I can do this. And then actually sitting with him, and I had to sit still for quite a long period of time because you can't kind of take them in and out too quickly. And it was, you know, maybe once a day that he could come out, and then when he went back in, he was really tired, and you could tell. So it is incredible how, you know, even holding the baby, how what an effect that has on them. But also it's very important, kangaroo care, I think it was called, to be able to hold the baby too. So yeah, that's kind of my story and where I come from and where my passion is. So yeah, it's great to hear what's happening, and hear about all the updates and all the new appeals that we're going to be doing to fundraise further.
So are there any particular moments or times that stand out to you as a parent on the unit? You know, because I remember through conversations that you and I have, because I'm quite a nosy person, that obviously you know, you used to like keeping their heads warm, so you used to rub his head.
Yeah, so they don't like being rubbed or stroked. You know, naturally as a baby you want to kind of stroke them, don't you? But they don't like that. They kind of like being treated quite firmly, really, actually, which I guess mimics the experience of them being inside the mother's tummy. So actually I was quite surprised sometimes when you see kind of how the babies are handled, but actually that's better for them rather than stroking them gently. And also little things like, you know, breastfeeding. So now I think that's improved. But at the time when I was in, it was quite difficult. There's kind of one seat where you would be able to go. There's just a curtain that kind of got pulled over, and that was in the room where all the fridges were, where people were kind of in and out as well, getting their own milk. So, you know, things like that, and having a special room for that, or a special area will make a big difference, and will help the experience. And obviously it's a tough time for parents to be going through, so anything like that can help improve their time and their experience is just going to make a difference.
And did you stay on the unit or did you go home?
For me, luckily enough, because I don't live too far, I went home. So yeah, the fact that, you know, I could do the journey and probably maybe managed it in about 5 minutes sometimes if I really needed to. Yeah, I was really lucky. But I know obviously that is there for parents who do live further away. And I remember again at the time when I was in with Mason, there was actually a parent who came from Brighton, and she, at the time, this was before we had our lovely accommodation, she was having to stay in a hotel. So every night going over to the hotel, you know, her partner was down in Brighton, so he was far away. So obviously if at the time we had this accommodation, that would have been, you know, would have made a big difference to her as well.
Oh, well, thank you very much. Sorry that I just quizzed you quite a lot. I was just being really nosy. So that's amazing, and that kind of brings us on to the next part of our webinar, and that is to expand to you as to what's happening with the neonatal unit. So we're building a huge, great big building. So if you've been anywhere near the Luton and Dunstable in recent weeks and months, you'll see that we took one very big building down, and we're now putting another very big building up. And we're very, very lucky in the fact that lots of our departments are moving across, and one of them is the NICU department. So I am going to pass back over to Tanith and Claire, because they are living and breathing this a little bit more than I am at the moment, and to try and tell you as to why the move is so good for them, and you know what other things they're going to be putting in once we move across.
Shall I start? And if Claire can get, I know she's having some technical difficulties this afternoon, but she'll chip in if she's managed to get connected. But yeah, we are really excited about the neonatal unit finally being built. As I said a few minutes ago, you know, this has been well, to be honest, a 10 to 15 year journey that we've been on. So we are so excited. What it's really going to allow us to do is have a state-of-the-art unit with a building that is built for that purpose. Any of you that have been in our current neonatal department, we still provide excellent clinical care. We've been able to progress our clinical care in an environment that has been less than ideal. The new unit is going to allow us so much more room. We're going to have dedicated treatment rooms. So I talked a bit about laser. We can have a dedicated area where we can do laser treatment for babies. We can do the diagnostics that I've talked about. So the ultrasound, we will do them at the cot side, but it also means we can move babies around the unit and take them into another area and support them. Rarely nowadays, but still tragically, we do lose some very premature babies and some term babies. But what we are going to be putting in is a dedicated bereavement suite for families, which means that they can stay with their babies for those last precious hours, and they can basically stay with them for as long as they want to in a bereavement suite that is in a quiet area. It will be furnished out as close as we can from a home from home to allow that freedom of families and for relatives to come in and grieve. As I say, it is rare, thank goodness. It's, you know, it isn't as common as perhaps some people think, but it does happen. We'll have rooming in rooms. So on the positive side, when we've had babies, so, you know, Sabine said, you know, she was probably in hospital for 10, 12 weeks with her baby. It's a long time. And whilst I don't like to use the word, you know, we do become institutionalized a bit as parents. My daughter's baby was in NICU as well, many years, well, nearly 10 years ago now. And quite quickly you get used to being in that clinical environment, having people around you caring for you. The rooming in rooms allow parents to parent before they go home, to give them confidence in their caring skills, and just get used to having a baby that's out of the incubator, that's out of the ward, so that they can sleep with them. We'll have cots alongside, and they can just get that confidence and build that, because that's certainly feedback that we've had from parents over the years. Is it's a very, very big step when you've been in the neonatal unit for weeks on end, and then basically we say, oh, baby's ready to go home, off you go. It's scary enough taking a brand new baby home that's been, you know, term baby, been fit and well if you're a first time parent, let alone taking a baby home that might have some very special needs, or that you've, you know, that's grown well, but you've had so much support around you. Those rooming in rooms will make a big difference. And again, we'll make them as close for home from home as we can do. We're looking at other systems just from a security point of view, making sure that we've got secure webcams for parents so that they can see their baby developing. You know, parents can't spend 24 hours on the unit for their own health and well-being, but often you have other children at home and siblings. So we're going to look to set up secure webcam systems so that parents can see their babies, they can interact and have actually that precious memory of them on the unit. We're also, one of the feedbacks that we've had from parents is being able to get in and out of the unit with more freedom, but safely. Obviously, we have to be secure, we have to keep babies and their parents secure. So we're looking at setting up what we're calling a biometric fingerprint entry system. So parents will have a dedicated fingerprint system that they can use to enter and leave the neonatal unit. So we know people that are coming and going. We have to work quite carefully on that one, so we don't get people that follow through. So we're working with parents when they come in for the safest way for that to work. But I think it will allow parents that freedom of being able to come in. We encourage visiting now. I mean, again, 10 years ago, it was very much sort of during the daytime, early evening, parents were in and they'd go home at night. But now we really do encourage that parents can come in whenever they want, across the 24 hours. And this sort of entry system supports parents, but also supports the staff. We'll have different monitoring systems. We'll have music devices, and importantly for parents and for those babies that we're getting ready to take home, some outdoor space. So we're looking at some outdoor space, certainly on the ground floor for maternity, but also we will have some space that's not right on the neonatal unit, but a floor below, and we were sharing some outdoor space with our intensive care partners. And that'll give some green space. And I think it's a little bit of the drawing you can see on the slide, our idea of how we're going to develop that area. And that will be encouraging parents when they can to take their babies down there, but also some free space from there for them that's not too far away from the unit, and also for staff to use. And I probably skipped over the music devices. The music devices we're using currently, but this is a way of us using an iPod system to play music and sounds into the incubators through to the babies, so they've got that interaction. And Sabine says, you know, the babies don't always want to be handled, but actually having some different noise and music we have found does calm them. So babies that are maybe going through treatments or other activity are calmed by having music therapy through their cots. So we're looking at extending that throughout the unit as we move. I think that's an update on what the unit's going to be like. So I didn't say, obviously we are going in, we're going to have a 40 cot unit with intensive care and high dependency, extended number of cots. So we will be able to manage more babies from around our region and our local catchment area. So hopefully babies won't have to go out of area unless they've got a special need like surgery. That's the only thing really as a neonatal unit we don't do.
That's amazing. Thank you so much. Claire, you had your hand up. Did you wish to add to any of those points?
Can you hear me now?
Yes.
Oh, thank goodness for that. My apologies. Yeah, I think it was just to add on really about the webcam system. So it's really going to focus a lot on those families who have come out of region. I mean, Sabine had pointed out earlier that a family was in the unit from Brighton, and there might be some scenarios where the mother has delivered in Brighton and her baby requires transfer to us for some treatment. And so obviously that separation has happened between that mother and baby, very unfortunately. So this webcam system would provide that opportunity for that mother in Brighton to live view her baby and talk to consultants and physicians at that time. So it's really quite innovative. The biometric fingerprint entry system is based on feedback that we've received from families coming through the unit over the past few years, who have expressed a bit of frustration really at the current system that we're using, and they're having to buzz and wait for the nursing team to buzz them into the unit, which can take some time, particularly if they're working with their babies at that time. So this system here will allow the families to automatically have that entry system and, you know, have that access. And I think it really shows that we're wanting to be partners in care with parents. So really good. The nurse monitor is, I know a lot of parents will know what saturation monitoring is, to monitor oxygen levels of babies, and this is really an extension of that, and it can monitor the brain oxygenation in particular, and the tummy oxygenation of babies as well. So it can advise clinicians and consultants and nurses really early diagnostics that Tanith had touched on before. So it's very exciting, I have to say, and the buzz on the unit for going into the new build is very exciting as well. So staff are thrilled. Thank you.
Thank you, Claire. That's, you know, I think it's very warming that you've really taken all the feedback from parents coming in as to what is required and what can help support them, but also in supporting staff as well, because I think, you know, we need to make sure that our staff are well supported on all of our units, because then, you know, we can then further our support to parents and patients. So, you know, this is an amazing thing to have listened to that and actually to have moved that forward. So huge thank you for the charity team for joining us today, Tanith and Claire, because, you know, to have that clinical and managerial thought and background behind things can really support in what we're trying to do on the unit and why we're trying to fundraise and why we did originally fundraise for this particular unit. So thank you very much. So that moves me very succinctly on to actual fundraising. So the neonatal unit, because of the fundraising that did happen, is in a good position in the fact that all of these items that they're looking to place in, the money has already been fundraised for. We always receive a lot of, you know, love for our neonatal unit, and we would always want to continue to receive that love, because as you can see, there are always more and more things that we can do to improve patient care, to make those lovely changes on the unit, which really do make a difference to staff and to patients and to their parents as well. So this is a little update on what our current fundraising plans are. So we have a Sky Panel appeal, which are interactive panels which are going in our children's emergency department. So this is to brighten up the area a little bit. So if any of you have had children, I'm kind of presuming because you're on this webinar that you have, and you've taken those children into an emergency department, it's really scary, you know, as a parent, it's really scary, but for that child, that fear is twofold, tenfold, 20-fold. So we are trying to make that a little bit easier going for our patients. So obviously a lot of patients, you know, often come in, they're lying on beds. So to have that distraction and for something else to think about and to look at, we're hoping will support their journey through the emergency department. So the next big appeals are going into the new block that we're building that I mentioned at the beginning. So as I said, if you've been on site, you'll see a dirty great big concrete building. That is where all of these areas are going to be going into. So we've nicknamed our maternity appeal the Little Feet Appeal, and we are supporting our maternity unit with, you know, making those really big improvements that make a difference, like putting in, you know, a treatment room, because obviously, you know, as Sabina said, you know, watching your baby being treated is, you know, you want to be gentle and nice and soft, and obviously you can't do that with babies, and it can be quite stressing on an adult to watch their baby go through that. So we want to put some treatment rooms in, we want to put some expressing rooms in, because again, like Sabina had mentioned, you know, expressing your milk in a busy room with lots of, you know, people coming in and out isn't maybe all the best for you, and it also, you know, might start your letdown reflex and you might not be able to pump as much milk. So if you've got a nice little private room, a comfy chair, maybe even a TV going on, you can see it, watch your favorite soap in the afternoon, and you know, may know that you're providing the best for your baby and the best that you can. So there's lots of different areas we're putting in. Additional bereavement suites. So again, sadly, you know, we do lose some babies, so we do want to support those families going through that by having, you know, rooms further away from the delivery suite, to support them in their journey, unfortunately. So, you know, to have those slightly less clinical rooms, somewhere they can stay a little bit longer, you know, not hear other babies crying is, you know, is really, really important for us to be able to support that journey for them. We'll also be putting in a bereavement garden as well. So this will be a space just outside of the unit where it will be fenced off, and it will be an outdoor area where you can go and reflect amongst nature, because nature is all healing. And, you know, just to have that space away from the unit, away from all of that, and, you know, to collect your thoughts and, you know, to have that space to be able to do what you need to do. So that will be one of the gardens. The other garden that we're putting in is the maternity courtyard garden. So, you know, when I was in labour with my first child, I was actually wandering around the L&D site because there was literally nowhere else to go, waiting for my labour to progress, because they didn't want me to go home, but I needed to walk. So, you know, rather than dragging my husband all around a lovely L&D site, maybe a bit of a garden might be a slightly nicer place to go. Because bless him, yeah, he was literally dragged all around the L&D while I was waiting for my labour to progress. So, you know, little things like that just make a huge difference. I mean, even, you know, my son is almost 17, you know, so, and I still remember walking around the L&D waiting for my labour to progress. So if you've got a nice garden where he could have stuck his feet up and played on his phone while I wandered around the garden, it's that those little differences that really make a difference. The other big appeals is the theatre robot. So this is a surgically assisted theatre robot, so not like when you sit and look at all the horror movies and some dodgy robot. It is still managed by a surgeon. This will reduce, you know, healing times. They're smaller incisions, they reduce infection. This is such a cutting edge technology. To have this coming into our hospital is absolutely amazing. You know, the benefits to patients and to surgeons is phenomenal to have this in place, and to start doing some of those surgeries. So, you know, when we talk about keyhole, this will re-keyhole, instead of a poor surgeon trying to get his whole entire hand in to do a tiny procedure behind something like the back of your knee. The robot can go in and do that with a much smaller incision. You know, there's much less mucking about within your body, and it gets you in and out a lot quicker. So the theatre robot is, you know, a phenomenal piece of equipment that we're going to be putting in. And the other one, as Tanith did mention, is the critical care garden. So the intensive care unit and the HDU are combining on the same floor, and all their patients will be across the same floor. So again, if you look at our lovely lump of concrete at the moment, you'll notice there is a little structure jutting out, and that is the balcony garden, and that is where critical care and the NICU units garden will be. So very much away from people walking past, but still able to get that very beneficial fresh air, sunlight, you know, to be outside. And the amazing thing about the balcony gardens is that, you know, we will be able to wheel patients out there, which is, you know, absolutely phenomenal. If you were to go back 50, 60 years, you know, patients were regularly wheeled outside to get their vitamin D, to get their fresh air, or to smoke, which obviously you're not allowed to do on site anymore. But, you know, it's that real health benefit of being outside. So this is, you know, again, this is really moving our hospital forward for patient care, and to support in what the body needs and the mind needs as well. So, you know, a lot of mental health, a lot of people say, you know, get back out into nature, get amongst your plants and your gardens and things like that, and that really aids your mental health. So the important thing about the gardens is that we're not only able making space for our patients, there will also be spaces for our staff as well. So, you know, our staff's mental health is very important to the trust. It's you know, we're really working on to support our staff as much as possible. So, you know, for people that need to go outside, we're giving them as much outdoor space as we can, and this will really tick those boxes. So they are our current fundraising plans. And we now move on to the very last section, which is if anyone has any questions for us. Hi, David. Did you have a question for us?
No, not at the moment. It looks really, really amazing, actually. The only thing I was actually thinking of, just literally on a little tangent, is where you've got the sort of garden area. Is there a way you could sort of say run a liaison with the schools to design the garden, and the children from the schools get involved by sort of designing the garden, and you have like a competition where they have a winner and that sort of thing? It might sort of outreach marketing wise into the community for a bit of great sort of PR for you.
That's a wonderful idea, and thank you for putting that forward, David. We will certainly look into what we can do with that, and thank you very much. I'm sure Sabina's ideas is already full of, already full steam ahead of what you can support the schools with. So, but no, that's a wonderful idea. Thank you.
Thank you.
No problem.
No. So if anyone else has any questions they would like to ask. Having quite a lot of clinicians and medical team here, it's a good time to ask them. Hannah?
I was just going to say, just while we're waiting to see if anyone's got any other questions, I think I'd like to take the opportunity to really thank all previous and future supporters of the hospital charity, not just the NICU, but across the whole of the site, and to just acknowledge how valuable that is. It really does allow us to go above and beyond the basics of the NHS, which we know is complex and not basic at all, but it allows us to put in some new technology, as we've talked about, but also those added value areas like gardens, like different wall finishes, so we can put up murals and such like. So, the charitable funds and any support that both staff but the community at large can do to support what is, fundamentally an essential part of our community and our hospital. I just wanted to say a huge thank you for the past and future supporters, really, because it's made a huge difference to us.
Thanks, Hannah. So as you can see, my email and telephone number is up on the slide. Rachel, did you have a question that you wanted to ask?
Yes, sorry, hello. Unless I missed it, I don't think we've talked about timelines at all. Could we have just a brief overview of the timelines, both for the fundraising appeal and for the build?
Yes, of course. So as far as I know, the build is due to be finished 2024.
Yeah, so it's September, so autumn 2024, the building will be finished. And I think we're hoping to have inhabited it with our patients by the end of 2024.
So we are looking to spend the next 12 months fundraising for all of these items to be able to put them in before the build ends.
Brilliant, thank you.
You're welcome. So as I say, my details are on the screen. Please contact me if you do have any questions or thoughts. I'm also open to some feedback, as this is our very first webinar, so open to all sorts of feedback. The next webinar is scheduled for the 13th of April, again at 12:30. So if you would like the link to that one, please get in touch and I can send that out to you. I'd like to say a personal thank you to everyone who joined today. Thank you very much. Thank you to Tanif, Sabina and Claire for talking as a part of this webinar. It's amazing to have that insight, and it really does make a difference. So we are hugely grateful, and I look forward to talking to you all soon. So this is going out onto our social media and onto our website once we've edited it for anything that needs to come out. But I am truly grateful for everyone who's joined. And I hope to see you all soon.